Good afternoon, and welcome to Stockton University. I'm John Frungen, Executive Director of the William J. Hughes Center for Public Policy here at Stockton. Part of the Hughes Center's mission is to help inform the public about issues that are important to society. For this reason, we are very pleased to partner with the Atlantic County Council of Education Associations and the Kennedy Forum to bring you today's panel discussion on mental health issues affecting our youth. Allow me to introduce Melissa Tomlinson, an educator for 20 years. Melissa is a special education teacher at Buena Regional School District. She's currently serving as second vice president of the Atlantic County Council of Education Associations and on the executive committee of the New Jersey Education Association. She will moderate today's discussion, and I turn things over to her now. Thank you.
Thank you, everybody, for attending today. I know it's hot out there, and if you were in nice air conditioning, it was hard to then transition to another location. Before we begin, there's a couple of thank yous and a couple of housekeeping tests I want to go through. I definitely do want to thank the William J. Hughes Center for Public Policy at Stockton for giving us this space to hold this important conversation. Also to my union, both NJEA and ACCEA, for supporting my vision to bring forward the issue of youth mental health in today's times. We have a couple legislators and a couple other important people here today, so I just wanted to make it known that they took time out of their day to listen to what the panelists have to say and also to listen to the question and answer discussion that will happen following the panel discussion, because we are in a very important time right now, and if we don't make some positive decisions in how we support the youth, we're going to be dealing with the crisis of a pandemic for a very long time. So I'd like to welcome Assemblywoman Claire Swift, who has joined us today. We also have Mrs. Leslie White Corsi, the Executive County Superintendent of Schools, in the audience, as well as Devin Blackwell, the County Education Specialist from NJDOE for Atlantic County. And then we also have the NJEA Vice President, Steve Beatty, that is here with us. So before I begin, I just want to give a little bit of background as to why we're having this conversation. It started a while ago, actually. In the middle of the pandemic, we really began to get worried about our students, right? They weren't in front of us in the classroom. We couldn't see them on Zoom as well as we could in person. We couldn't do visual well checks. So we knew what we were experiencing during the pandemic and the stress of what we were going through with our own families, our own personal lives, and then educating these students. We could only imagine what the students were going through, right? As youth, not having some of the tools, not being equipped to handle some of the trauma that we were dealing with on a daily basis. And then as we began to go back to school, the realization hit us that some of these kids had not been in school during very formative years. So like students that were fourth graders were now coming back to school as sixth graders, as seventh graders. And that's a big shift for them to suddenly get thrust into a middle school. Now, I don't know if you can remember back then when you were a student and all of a sudden you're changing classes, you have lockers, you have different things that you have to worry about, you have 10 different teachers telling you 10 different assignments during the day. It's a lot to handle, and we saw the effects of it right away. We saw a lot more behaviors in the classroom than we were equipped to handle and that our schools were equipped to handle. Now, New Jersey is one of the leading states in the nation for mental health supports for students, but that doesn't mean that there's not more that we can do. So as we were having some discussions amongst ourselves as educators about what we were seeing, we decided that we really needed to have a conversation. And then as we were having that discussion, I came across Amy Kennedy's from the Kennedy Forum, came across the Hopeful Futures campaign and the national report card that they put together that analyzed the mental health support services in schools across the country. Simultaneously with that, the New Jersey Department of Education released this 300-page document on best practices for mental health in schools. Now, I don't know about you, but me as an educator, I don't have time to read a 300-page document, right, to analyze it. So, I'm hoping that as decisions are made, that we look at some of the information that's already out there for us. We analyze what we have right now, and we make some decisions about what we need. And that's part of today's discussion, is doing just that. So let me introduce our panelists. Oh, before I begin, I do want to let everybody know this is being recorded. Everybody can share this out with their prospective organizations. We're hoping that a lot of people end up seeing this recording. It'll be up in about a week, correct, John? Yeah, so it'll take about a week for it to get up there, and we will send the link out to everybody whose contact information that we do have. So our panelists, right over here we have Victoria Druding. She is currently a local school nurse. She's been a registered nurse with a Bachelor's of Science in Psychology, past experience in mental health, formerly a crisis screener for the state of New Jersey. And then we have Lisa Seymour. She's Atlantic County's Youth Services Commission Administrator. Then we have, I think I'm going in the right order. Yeah. Yep. James Rayner, Superintendent of Greater Egg Harbor Regional School District. We have Dr. Brian Isaacson, Chairman of the Department of Psychiatry at Atlantic Care. Dr. Sarah Martino, Director of the Masters of Arts in Counseling Program, Professor of Psychology and Counseling at Stockton University. And then Amy Kennedy, Board Member of Mental Health America, Interaction, and the JED Foundation, as well as Brain Futures. So as we were planning this, the realization came to me that I have a lot of people on the panel with a lot of different experiences. So we created some discussion questions, and then I asked the panelists to kind of sign up for specific areas that they were comfortable speaking about. So you will hear me kind of call on some panelists sometimes. And then if other people want to chime in, depending on what time we have, I'll allow some of the other panelists to chime in. But to begin with, part of the process involved in creating change for a better future is to develop an understanding of where we are and what things look like at this point in time. It's especially important right now because the pandemic has provided us with many things, new challenges as well as opportunities. It has also, as we all know, highlighted and shown a spotlight on the problems that have already been in existence. So we're going to take a few moments and set the stage for our conversation today by first hearing from our panelists that can speak directly to current experiences. So in general terms, how would you describe the current state of the mental health of our youth? And do you feel that our current systems are sufficient in providing the resources and supports that our youth need? And Victoria, I have you up first.
Yes, thank you very much, Melissa, and thank you for having me tonight, and thank you for the audience for attending. As a school nurse, we are often the very first line of refuge for a child that has emotional problems. Many nurses are there functioning as first aid. Let's take care of the physical problem. But you realize when the child presents with stomach aches, headaches, crying, sleepiness, irritability, that you're dealing not with a physical problem, but a child who has emotional problems that cannot express them. We're seeing more and more of that, especially post-COVID. I think that transition didn't cause emotional problems, it helped elevate them. So we are, yes, seeing more issues with more children. And second question, yes or no? I'll just say that.
Do you feel that our current systems are sufficient?
No, that's one of our greatest challenges as school nurses is finding help for the children. It's often very difficult. In the last few years, I've chosen to work in communities where they're economically challenged, and lots of times they fall into a hole where they can't quite get classified, and parents may not have insurance, they can't qualify for Medicaid. Often the systems that we offer are overburdened, and the wait time is very difficult. Crisis units can identify whether a child is harmful to themselves or others, but cannot come up with a treatment plan. That's not their directive. So it is very frustrating for us. The child is returned to the classroom. Teachers, they're already overworked. They're not in a position where they can handle a child that has issues and does not fit into those slots to get care. So yes, I have found it to be very challenging over the last couple of years.
Great. And Dr. Isaacson.
Thank you, Melissa. And thank you for organizing this important discussion. And to all of my esteemed panelists, thank you for being here to engage in this discussion. And thank you to the audience as well. So, in short, no. In short, the mental health of youth is very concerning right now. We are facing recent statistics from national studies that show that 1 in 5 children have a current mental health need in any particular year. That used to be 1 in 6 just a decade ago. That's a significant increase in numbers. And even more concerning, less than half of those children will get the services they need due to inadequacies in the current system of care. In the last 5 year, or in the 5-year period from 2016 to 2020, children suffering from anxiety increased by 29%. In that same time period, there's a little bit of lag in the data, but 2016 to 2020, depressive disorders increased by 27%. We've seen suicide in the decade from 2010 to 2020 rise by over 37%, and it's now the second leading cause of death in 10 to 24-year-old children. This is disheartening. And our current system is currently inadequate to care for these children, and there's multiple factors in that. We certainly know that Patrick Kennedy and others have done great work around mental health parity. In 2008, we had a Mental Health Parity Act passed, the Mental Health Parity and Addiction Equity Act. We also know that that act has not been enforced as intended. There was a recent report in just January of 2022 by the Department of Labor, Health, and Human Services, which showed significant failures to comply with the standards of the mental health equity laws. And this is important because this drives our ability to deliver care. In addition, there was a coalition of organizations spearheaded by the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatrists, and Children's Hospital Association across the nation. And they, along with multiple other organizations, in this past year, they've declared an emergency around children's mental health. They've said we are facing a crisis point and we must act. It's really a call to action. And I want to quote a few things from their report, just briefly. They say the pandemic has exacerbated the already existing child and adolescent mental health crisis that existed in our nation. The inequities that result from structural racism have contributed to the disproportionate impacts on children from communities of color. Rates of childhood mental health concerns and suicide rose steadily between 2010 and 2020. The pandemic has intensified the crisis across the country. We have witnessed dramatic increases in emergency department visits for all mental health emergencies, including suspected suicide attempts. This is just one sign that we need to act to help address the system's issues.
Thank you. That's some pretty shocking statistics that we have going on right now. I'm going to pause for one brief housekeeping point that I forgot. We have Adam Sheridan here helping us today. He has the index cards and the pens for the question and answer. So if you have a question, if you think of it, just get his attention. He'll hand you a card and a pen. So as part of the effort to urge education systems and communities to address the immediate mental health needs of youth, the Hopeful Futures Campaign, a coalition of national organizations, released state report cards outlining actions each state has and can take in key policy areas to promote student mental health and well-being. The report cards found that New Jersey has made great progress in prevention and early intervention measures, including mental health education, screenings, and well-being checks. So I'd like to hear a little bit about what New Jersey has implemented this far and what it looks like currently in our schools. And if we could hear from James, please.
Thank you, and thank you again for the invite and for all those that put together this important conversation. I think the most important place to start with this conversation is saying that, and I've been in education for 21 years, I think we are finally swinging to a proactive approach instead of just becoming reactive. The Department of Ed has led, and when the Department of Ed leads, then individual school districts from the county level to the local level follow. And they have put together some wonderful programs, some webinars. You know, we all had an increase in our digital IQ over the last couple of years, and I think we realized the value of the webinar. And there's a series that was begun this year and is continuing on now that talks specifically, it's called the Comprehensive School-Based Mental Health Webinar Series. And they are actually presenting to districts a 5 or 6 step process. Identify your need, beginning with staffing, running all the way through the continuum to how do you deal with an individual student in crisis. And I think one of the challenges that we face is, in the state of New Jersey, the diversity is one of our greatest strengths. I always say as an educator, I love that my kids are going to school in a community that represents the state and that represents the world they're going to walk into. But at the same time, there are vast differences that exist in our districts in size and in economics. And everybody so far has touched on the idea of the different resources that are available to communities. And the Department of Ed, I think, is shrinking that gap that exists between those different resources when they put out a webinar series like this. When they actually start grading us on, you know, what is your number of students to school psychologist, your number of students to social worker. And when we have to start answering those questions, it now holds us accountable. Not to them as much as, more importantly, to our taxpayers and our communities. What are we doing to provide healthy environments within our schools? And if I could just end on one note, though, that to me is, I think, my concern moving forward. A lot of smaller districts were really buoyed over the last year and a half by federal funding, and you were able to put in wonderful SEL and emotional and mental health programs. Moving forward, though, I don't know that smaller districts or districts that are already struggling financially are going to be able to sustain these programs, are going to be able to sustain these resources. And therein lies a real potential for danger, in that, you know, there was a specialist in a building that in some districts might disappear in 2 or 3 years. I'm very fortunate, and I partner with Atlanticare for a number of contracted services in all 3 of our buildings. But I know a lot of districts that won't be able to sustain what they've used their federal dollars for moving forward. And I think that's where we have to circle back to the state as a whole and say, you need to provide us some assistance if we're going to continue on with these much needed programs.
I want to elevate the piece you mentioned about accountability, right? As we talk about even things, accountability of standardized testing and how we hold the students accountable and the educators accountable. And the other edge of that, the other side, is making sure that we hold the schools accountable, right, to provide the resources so that the students do have a chance to thrive. You mentioned Atlanticare, so let's hear from Brian a little bit on this.
Yeah, thank you. So I want to start off talking a little bit locally and then move to the state level. Locally, Atlanticare is doing a lot of great work around this issue. We have services with our teen centers at our Atlantic City High School, at Oakcrest High School, Buna High School, and Buna Middle School that provide mental health counseling, they provide group services, they help do academic support, job readiness, etc. We also have healthy schools, healthy children programs at multiple sites such as Apsagami High School, Cedar Creek High School, Molica School District, Folsom, etc. And I could go on, spending some time covering all those programs, but we have a widespread programs. But as to James' point, that's not existing everywhere. And looking at the state report cards, and I'm going to definitely borrow from Amy here, the Hopeful Futures Campaign report card, we as a state are improving, but there's work to be done. We've improved from, in 2015, to 22nd in mental health service delivery to 7th, which is great, but there's still such huge gaps. We have improved with our ability to help screen our perform mental health education. That's been a big improvement, the report found. We've seen more bills to support requirements for mental health education, for substance abuse education, and that is great. We also have had improvements where we've had skills for life successes, and there's been some improvements there, but not standardized improvements. There's some opportunities there. There's also some opportunities around bolstering suicide prevention education, and that was noted to be a significant opportunity. There's been meaningful progress in wellness checks and well-being checks, and we are screening kids now in New Jersey by mandate for depression in grades 7 to 12. But we know, just those statistics I just told you a question ago, we know that children younger than 7th grade get depressed. What about those children? We need systematic screening for them as well. To James' point, though, one of the things that we need for this is also financial support. If we have unfunded mandates, that creates problems. You have to rob one program to pay for another. And unfortunately, the reports have shown that we have not made any significant progress as a state around funding for services for mental health. There's shortages as a result of that. We have shortages. Our school psychologist, we have one school psychologist in New Jersey for every 731 students. The recommended number is one for every 500. We have one social worker for every 655 kids in New Jersey. The recommended number is one for every 250 to meet these burgeoning needs. We have one school counselor for every 358 students. The recommended number is one for every 250. And then for child psychiatrists, we have 17 per 100,000 students. The recommended number is 47 per 100,000. So these are huge deficits, and there's still a lot of opportunity that we need to address.
Yeah, I definitely agree. I remember not the beginning of this school year, but the school year before, our school-based youth service programs, they were on the shopping block, right? That was a very scary time. Atlantic Care is also in my district, and I personally went into a panic when that happened, right? Our district, our students would not survive without Atlantic Care in the building. And, you know, we face several challenges, as was just highlighted, in delivering comprehensive mental health services and supports in our schools. So I'd like to hear some viewpoints on what the greatest challenges are that we're currently facing in our districts and in our communities. So if I can hear from Dr. Sarah Martino first.
Yes, thank you. And again, I'll echo others saying thank you for hosting this important event. I am currently the director of the Master's in Counseling program here at Stockton University. So we actually trained licensed clinicians at the master's level. So that would be an LPC or licensed professional counselor. So in the statistics that we just heard from Dr. Isaacson, that population is somewhat missing in those statistics. And when we talk of a school counselor and ratio of school counselors, that's not really intended to provide the most important mental health services for students who are experiencing the most concerning issues. So I actually specialize in working with adolescents in the group practice that I work in Burlington County. And some of the things that we're seeing among youth today, outside of just depression, which depression alone is a very serious issue, but we've seen a huge uptick in self-harming behaviors. This was pre-pandemic, and again, as Dr. Isaacson suggested, has only gotten more significant since the pandemic. So when we're talking about a 14 to 17-year-old population, anywhere from 17 to 35% of our youth are engaging in self-harming behaviors, such as cutting or hitting themselves. And then we also have seen an uptick in disordered eating behaviors. I also specialize in that and consider that under the umbrella of self-harming behaviors. That issue in particular, we've seen an uptick since the pandemic. And again, as Dr. Isaacson suggested, the statistics are a bit lagging, but I can tell you in my own work, I've seen a huge uptick in restricting behaviors and binging and purging behaviors since the pandemic. Another issue that has both facing our community and our school districts that hasn't been brought up yet is cyberbullying. So this, again, was an issue prior to the pandemic. And during the pandemic, I think we kind of shifted our focus to, making sure that students were participating in school and that they were getting on and getting their virtual instruction. But cyberbullying didn't stop because of the pandemic. In fact, it has gotten worse. And so we are seeing, especially among youth who identify as multiracial, an increase in acts of racism and bullying that are occurring virtually online. And then we also have seen an uptick in bullying behaviors that have occurred since coming back from the pandemic. Another important point about the pandemic in general is that every school district in the state of New Jersey and across the country handled it differently. So some have been in school for over a year, whether that was hybrid instruction, half days, or something similar. Other school districts, as was mentioned, I believe, by Melissa, did not have any in-person instruction until recently, until this past school year. So I think we also need to address that. The last point that I definitely wanted to make, kind of alluding to the training that I do with my students, is we need more mental health professionals both inside the school and also contracted to provide those mental health services outside the school, especially for the most severe issues that we're seeing. They simply can't be addressed during the school day, and there needs to be better communication and funding for mental health care outside of the school setting. Currently, as of the state of mental health in 2021, only about 1/3 of youth who experience a major mental health issue access care. And that's even for states like New Jersey, where we have better access to mental health care. So that's something that is facing our community and we definitely need to improve upon.
Thank you. Victoria, since you're in the school right now, let's hear a little bit about what you think our challenges are.
Well, first let me say Dr. Martino really hit the nail on the head, particularly with funding and running that down. The only thing I would add to that is if we're going to increase staff, we need to look at the diversity in our schools. We have a lot of kids, just like Mr. Reyna said. There's very diverse Latin communities, Black. Within the Latin communities, there are different communities within the Latin communities. They all feel differently about getting help for mental health issues, and it's not easy. And I think that when we need to look at staffing, we need to look at trying to promote staffing for the Latin and the Black community. It's a different treatment plan, it's a different focus, and that I think that we need to look at also. So everything she said,
Plus.
it's the truth. Plus, yeah, let's take a look at the diversity that represents New Jersey. We cannot expect that some therapists are going to be able to work smoothly with all students.
I agree. And Lisa, I know part of your work as the Atlantic County Youth Services Commission, we're always looking at demographics and numbers. And since you deal with at-risk, and we still do have a higher percentage of Black and Hispanic population that do end up somewhere within the system, would you speak to this a little bit? What are the challenges that you see as students kind of progress negatively through the system?
Through the juvenile justice
Yeah.
system, once they get there. Thank you, Melissa, for having me, and I definitely echo what Victoria and Dr. Martino have said. And so I would just add that for us, what we're finding is that, especially for communities of color, when you're talking about mental health treatment, it has to have a different presentation than what we would consider traditional outpatient services. And so what we're finding is that it works better if you embed these types of services in the communities where the people are, oftentimes delivered by individuals they see in the community as points of contact, trusted individuals that know what they are going through in their community, have been where they are. We often find that when we develop what we call traditional outpatient services, they aren't often utilized in communities of color for that reason, because they're presented by people that look like me. And so, they are not always the most successful. And so it makes it more challenging, and you have to be more creative in getting with those individuals that are most at risk. But I would definitely have to echo, funding, is an issue. funding in the traditional sense, because that's what the Youth Services Commission does. We take funding from the Juvenile Justice Commission, and we provide services for kids that have been involved in the juvenile justice system, in addition to delinquency prevention programs. And so what we're looking at now is, how do we provide funding to grassroots organizations that are actually out in the community to do that kind of work? Because like I said, we're finding that that is what works. But I would just definitely have to echo, we have high demand. We have kind of the same pool of resources that everyone is going to, and that presents a challenge. The other thing that presents a challenge is that, and this is a controversial topic, but it is something that we see for youth, consent to treatment. The ability to say at the age of, I believe it's 14, that I don't want to participate in therapy. I don't want to participate in counseling. And so, like I said, that is a controversial issue. I'm not arguing either side of that, but you have to be aware, and I think professionals in the room have probably experienced that frustration when you hit that wall. And so we're a youth who we feel, and the family we feel, could use assistance, but they're saying no. We don't need it, we'll handle it. And that's kind of where we go back to, if you have services embedded in the community, those trusted individuals that have established relationships, that you become more successful at providing that treatment.
So based upon some of the ratios that we heard and the fact that we need more mental health professionals that demographically represent the communities that they serve, we definitely have a lot of workforce challenges right now. We need to invest and grow the school mental health professional workforce. It's a paramount concern around the state. What are some of the unique workforce challenges that we face in South Jersey? How can we improve these ratios through incentives or other measures? And how can we also support those already in the field that are currently working under unprecedented pressure and stress? And Dr. Martino, since you are already working with some hopefully upcoming people that we will see in our schools, would you like to respond?
Yeah, so I think related to the first time I responded, in terms of funding, I do train clinicians to go out into the field. Some of them would be interested in working in school settings, but we're met with difficulty because there's sometimes not a licensed person in the school setting. So meaning either a licensed social worker or a licensed professional counselor or a licensed psychologist. So at times, school psychologists can do the assessment piece, but they don't always have the license to provide the mental health therapy as well. So I think one of the things that we could be doing is to at least have a point person at these different schools where we could have interns come in. I actually did have a student who went into Atlantic City High School and attempted to do an internship there. And the challenges that were met at the time were around the pandemic, just being able to get students to come down to an office because there was a lot of restrictions in terms of leaving a classroom, going to another room. And so some of that might be alleviated, which I think we'll talk about later with telehealth supports. But I think in order to improve those ratios, some of the things we could do is rely on training programs for different clinical social workers and counselors so that we're able to have a bigger workforce within the school, and they're not all required to be licensed clinicians. Some of them can be in training programs. And we have wonderful accrediting bodies that oversee the different training programs. Our social work program here at Stockton is accredited. The counseling program that I'm running is under the accreditation process right now. So we can assure that the training program is strong and that it's following ethical guidelines, but it's a way to increase those ratios in the short term, even in the face of losing some of the federal funding, as Mr. Reyna mentioned. I also wanted to say, I think that's an interesting question in terms of how to help those in the field who are under pressure and stress. I think self-care has been promoted, but I can speak in my own work that it's not really being actualized because we have such long wait lists and we have this pressure to serve the community and a lack of the ability to do that. So I'm not sure if it would be more self-care or if it would just be getting quicker access for those who do want it so that the wait lists aren't so long. And especially, I know Cape May County definitely struggles in terms of long wait lists and lower ratios of licensed clinicians in those areas. So just building out different either community-based mental health or more infusion in the schools so that clinicians aren't feeling so much under pressure. I think parity is an important issue as well. I know many of the students that I have had in my program have gone on to do group private practice because insurance is so difficult to get reimbursed, and it definitely doesn't appear to be valued. And so it's easier to try to charge out of pocket, but then that creates other concerns with access for youth.
Thank you. And, you know, we can keep trying all these different things, but at some point in time in this state, we're going to have to realize that we need some long-term solutions, and we need the structure and the policies and the legislation to back it up. So I'd like to hear from Amy right now, who is our residential policy legislative expert on the panel today.
Thanks so much. I think you heard so many good points already, you know, when it comes to things like parity. People want to do this work. They want to help others, but you have to be paid for that work. And for us to build out the workforce that's going to be needed, we need to have the Medicaid reimbursements raised. We need to have insurances covering this work. It's very difficult for schools to do billing themselves because we have really small districts in New Jersey, and they can't take on billing Medicaid, billing private insurances. But for us to build out the necessary workforce, we have to increase those rates so that people will continue to go into this field, stay into this field, and have greater access for students. We talked a little bit, you alluded to telehealth, which can be an important piece. It's not going to be the panacea for all of the things that we're seeing, but it can be used in instances like we heard about earlier from Victoria about cultural competence. So being able to bring in providers when there may be a language barrier, there may be a lack of somebody in the building that is relatable for those students. It also has been used effectively in other states. So in Texas, they've used that for TChat. And there are examples where it not only is the Zoom that we've gotten used to, but keeping in mind that there's a lot of students who don't have internet services at home. So can it also cover audio? So that they can just call in, texting for support. Looking at programs where we can get support and funding that's going to be sustainable. Because so many school districts have been fortunate to start using ESSER funds and the pandemic relief funds, but knowing that that's going to end, they've had to spend those funds, and it's challenging to think that they're going to bring staff on only to let them go in a year. So how else can we spend those dollars? A lot of schools are thinking about multi-tiered systems of support. So can we build out something that's going to be for the general population of students, things like social emotional learning, life skills, screenings that can be done during transition times in students' lives, because we see that's where a lot of students struggle. But you're also going to need that tier 2, which might be a temporary extra support small group for students. And then tier 3 would be more intensive. New Jersey specifically has a lot of out-of-district placements, and a lot of that comes from behavioral health challenges, because we're not able within the school to be able to provide those resources and meet the needs of students. So there are some policy changes we can address. The expansion of Medicaid beyond students who have an IEP will be a top way to meet those demands, and I think we're going to talk about that in a little bit. But partnering with our community partners, AtlantiCare, with universities to meet that demand, not only in building the workforce, but also helping us to analyze the data and make sure that we're doing good work in the schools. Because we want to know that this is effective. As we start to put the money into this, are we getting the outcomes? Everything's moving to outcomes. Are we getting the outcomes we need to see as we continue to invest in students' well-being?
Thank you. I'm going to shift into the next question since you started to discuss the models a little bit. So we do have an opportunity right now to reimagine schools in our communities as a place of healing and to access additional resources for the range of social, emotional, and behavioral health supports needed to support this paradigm shift. So one model that is often discussed and people really need to learn a lot more about it, as well as educators need to learn more about it in order to create these healing-centered engagement classrooms and really address the adverse childhood experiences, or the otherwise known as ACEs, and the trauma that we see. So if I could hear from you, Dr. Isaacson.
Thank you. So I'm not sure if everyone in the audience knows about adverse childhood experiences, so I just want to briefly touch upon them. Those came out of a lot of the work in the mid-90s, research that was conducted and showed that children in the United States and around the world go through certain traumatic childhood events that can have long-lasting negative impacts on their life. This includes, at least in the original data, physical abuse, sexual abuse, emotional abuse, physical or emotional neglect, household members with mental illness, particularly if it's untreated, a mother who was treated violently in the home, divorce, an incarcerated relative, or substance abuse in the household. Some more recent research in the later years has expanded upon that a bit, but for time purposes, I won't go into all of that research. But what studies have shown is that if a child experiences multiple ACEs, which unfortunately about 20% of children in the US experience multiple ACEs, that they have an increased risk of many different negative health outcomes, things like depression, cardiac disease, respiratory disease, even cancer, and many other things in between. And so this work is really important to address early and in a meaningful way. And a lot of the research in the 90s focused on trauma-focused therapy and trauma-based therapy. And then in 2018, Dr. Sean Ginwright proposed the health-centered engagement model, which is really a sort of holistic view. And I'm going to use some of his words here. He says it involves culture, spirituality, civic action, and collective healing. And really, in a nutshell, breaking it down, he's focused on what are the assets a child has, or an individual has. It's not just for children, it's for anyone who's been through trauma. He says, rather than what's wrong with you, let's focus on what's right with you. Let's focus on how you can help heal others, how you can help heal yourself. How can you dream for a better present, a better future, and build yourself up? So he really focuses in on teachers having a few different philosophies to make this work, or techniques. He talks about first, teachers need to start building empathy. And it's not just teachers, it's people working with these youths in general. He says second, encourage young people to dream and imagine. And third, build critical reflection and take loving action. And one of the things he talks about, which I find so interesting because it goes back to our last question, he talks about empowering children to help heal those around them as well, including the therapists that are working with them. They can be a positive force for those around them. And it's a very revolutionary model, and he says it can help with communities, help with schools, help with individuals. It can help at multiple levels. So that's sort of the model in a nutshell.
Could I add something real quick to that? As far as ACEs go, I'd like to just give a shout out to our local Department of Education, and I hope everybody in the audience or watching this can feel good with a little bit of information that our county office actually started running professional development related to ACEs pre-COVID, about 4 or 5 years ago. And all you had to do as a local district was sign up, and they would bring a team into your district and run through, from the very beginning, the origin of the research up to, the focal point of getting to learn your students and your students' lives. Many of us have very different homes than our students, so we need to shift our focus from our life or our experience to our students' focus. And that's how you begin to address ACEs, is to understand what they have gone through. So I do think it is important to realize resources like that are available. I know one individual, Mr. McKnight, that worked for the county office. He hit just about every single district in Atlantic and Cape May County pre-COVID. So there really has been an ongoing focus to educate staff related to ACEs and trauma-informed decision-making with students.
And if you're involved with NJEA as well, there's probably not a meeting that does not go by where, especially our vice president also mentions ACEs and the importance of understanding and really digging into the programs and trauma-informed instruction in the classroom. So we are definitely having that conversation at least. But, you know, unfortunately, we have kind of opposing discussions going on right now in society, especially in light of what just happened in Texas, right? We have a tragedy. We lost lives. We lost educator lives. We lost student lives. And so you see some people today saying we need more police in schools. And then you have the other end of the conversation that says, well, by the time the police are needed, just as we saw, it can be too late. So this is a really important discussion to have right now. And how might school districts revisit the necessity of school police and their role in school climate and culture issues and the allocation of district resources to work towards centered healing? And if I could hear from you again, James?
Certainly, thank you. Certainly, I have to start by saying, as a school administrator, I don't know how you wake up the next morning and stand in front of a community. I have the utmost heartfelt concern for those individuals and that entire community moving forward. We've seen over and over those communities do not recover. Related to this issue locally, though, I think it's important. I believe Amy talked about the different tiered approaches. So if you start with the idea of a proactive approach, a tier one that builds relationships with all students, and when the teachers and the counselors and the security guards and the coaches and the secretaries and the custodians feel free and are empowered to build relationships with all students, the proactive approach is a student will share their concerns. A student will reach out for help. A student will say, hey, I'm concerned about what I'm hearing my friend talking about or doing. You know, we are a district, to speak to myself, that does have SRAOs in our building. One of the things I think it's important to understand is the flexibility the state of New Jersey has given districts. You can partner directly and have your local municipality put an officer in the building. A full-time officer, you can work with them to get class 2 or class 3, which sometimes are retired officers, which financially can greatly help districts. We take a different approach, and we only hired retired law enforcement as our armed security in our buildings. And I'll speak to that for a second, because what it allows us to do, they don't have arrest powers. So that idea of the individual who's providing the protection can also be that individual arresting them, which again, in black and brown communities, that statement has tremendous weight and impact. So our SROs are typically older, they're retired, they've walked through those shoes, they've had those conversations. So from my perspective, one of the things the school has to do is look at who they are ultimately bringing into their building and what do you want them to accomplish. So one of our guys is head of a fishing club, so he's going out a couple times a month with kids and sitting on a pier and fishing. Those kids are going to share information with him. Those kids are going to provide feedback. You know, we've got another one who coaches a sport in one of our buildings, and I think it's that idea that if you look at them as a police officer in the building and you call them a police officer in the building, there is a stigma that is going to come with that. If you find another way to make them a part of your community, and that's what we've tried to do at Greater Egg, they are there, God forbid, to provide the safety with us if we need it, but they are not there to get students in trouble. They're sitting down at lunch, having lunch with the students. As I said, they're coaching them, they're taking them fishing, and it's that idea of building relationships. And the next level of that, though, is all of our buildings are open for our local police departments to come in and walk the building. And that's so our kids see officers in the buildings, and it doesn't mean there's something wrong. Those other officers are coming in. And certainly there are some who do not agree with this philosophy or who have different opinions, but we've tried to create an environment whereby every time you see somebody, quote unquote, in a uniform doesn't mean somebody's in trouble. And I think that's where it has to go to, that they fill other roles. They serve other purposes to the students. And I think that creates a trust factor that then is built between the students and those that are protecting the schools.
Victoria, you had some thoughts on this as well?
Yeah, I think it's a complicated question. There's a lot going on out there, and I think, Mr. Reyna, what you're doing is admirable, because in some ways you have no choice but to work with police officers, and then you're doing the best you can. I think that we can do more. I don't see this problem going away anytime too soon. I didn't have police officers when I went to school. In my school, they were police officers. But our children, that's what they're used to. My experience with police officers, and I'm not disrespecting them, my son is a retired police officer. I grew up around police officers, but I can tell you that training in mental health was not number one. They don't always have an appreciation between the difference between a child that is a behavioral problem, criminality, as opposed to a mental health issue. I think if we have to have police officers in the school, if that's where we're at, I think they should be required to have some kind of training and work with the social workers. It's great that they're doing those things in your school. I wish more schools would do that, but I think that they need to collaborate with their social workers and their counselors, whatever the school may have. I think that is a start. I think training is important. I also think, to spin off Amy's comment about telehealth, we need to start thinking outside of the box. What we're doing is not enough. I think that's obvious. And short-staffed and lack of funding is a continual theme in our discussion here. We have to have representation in our state and our legislature that will advocate for our schools and get the funding they need. These are our kids. These are our resources. Every one of us have sat here and recognized that there's a lack of funding, there's a lack of staffing. I think we can all figure out what to do if there was some money. But again, I think we need to think outside of the box, how we can best utilize students, people who are interns, to help work within the schools. They're out there. We need to pay them. We need to get them on board.
Thank you. I'm going to talk for a moment about a model that's specifically in New Jersey that has been in Gloucester County specifically for a couple of years now. It's called the Clayton model, and it's an agile, responsive, trauma-informed intervention program developed in New Jersey's Clayton Public School District. It's structured to offer, as we have been speaking about, a network of support services spanning from individual student support, teacher resources, classroom strategies, to tools for parents to incorporate SEL strategies in the home, and serves all students within a school regardless of classification. Some districts, such as Clayton, are able to offer universal school-based programs that are trauma-informed intervention programs, and they have these centers within the district called Child Connection Centers that utilize a single intake process and common family assessment plan across all implementation sites. They incorporate student supports focused on promoting positive youth development in classrooms and at home through classroom presentations, family check-ins, counseling support in small groups, behavior plans, positive reinforcement, and family engagement. Family supports focus on providing parent consultations, family plan development, and connection to community support and services. Classroom supports for teachers through connection with an educational consultant to assist teachers in classroom management, assistance in goal setting, development of a reinforcement system for positive behaviors, and methods for engaging adult caregivers in their child's academic success. So it's obvious through this, it's comprehensive, right? We hit every point. We're hitting in the community, the parents, the student, and we're looking at the whole picture before decisions are made. So I'm curious to know, we do have community partners in New Jersey, and Lisa has done a lot of work with trying to engage the schools and different community partners. So if you'd like to give us a little bit of insight as to what that looks like on your end.
Sure. So, as I said, the Youth Services Commission part of my responsibility is to look for and put out opportunities for funding to a number of, different entities, everything from grassroots organizations to our more, traditional 501c3s, nonprofit organizations. So this is what I'm going to say. As a person who does that, and as a person who already has funding from the Juvenile Justice Commission to do that, some of the things we have found, it's often not easy for individuals like myself to move into schools to provide those kinds of services. And I know that's because you all have a lot to do. You have a million mandates that you have to cover in a day. In addition to all the other things you're doing outside of education. So I understand that, but what we see, and we have a gun violence prevention life skills program that we fund, the Youth Services Commission funds, using Juvenile Justice Commission funding, that operates in the Pleasantville Middle School, Martin Luther King Complex School in Atlantic City, and Pennsylvania Avenue School in Atlantic City. That's a program that's been in operation many, many years. It is a very strong collaboration with the school guidance counselors, the school administration. It is something that those schools actually, we identify them with, it's still existing. Gun violence in our community is at an all-time high. And so, we developed this program. It's, like I said, been operating for years. And what we find is when we have that strong relationship with the schools and the school personnel, that program flourishes and its outcomes are wonderful in terms of, decreasing favorable attitudes towards violence and gun violence, increasing protective factors for those individual youth that are, in the program. It happens during the school day, during health class, and again, it's been something that has been done with the, individual school. And so we find that when we can establish those partnerships, they provide good results for the individual students and the school personnel as well. The other thing that we have a collaboration, the CIAC, Children's Interagency Coordinating Council, it's throughout the state of New Jersey. They collaborate with the Department of Child Protection and Permanency. They have what's known as a Youth Services Education Committee. I'm a part of that committee. We go out and we provide education concerning all of the services that are available to Atlantic County, in Atlantic County. We go out to schools pre-COVID, actually being a part of professional development days, and each one of us, speaks on the services that we have to offer. We've done really focused stuff also, the programming that's offered through my unit, the program that's offered through the Workforce Development Board, all the programming that's offered through the Children's System of Care, which we haven't touched upon yet today, but that's a big go-to for educators, in terms of, when services are needed for youth. So that would be, like mobile response through Atlantic Care, it's access through Perform Care. And so I guess my comment is when we have that strong relationship with schools and partnership, it's to everyone's benefit and the programs do well.
Thank you. Just a little personal history story here. So I was on the Atlantic County Youth Services Commission for a little while. And I had gotten involved with it. I reached out to Lisa and I said, I'm not necessarily seeing the supports that I feel my students need. So there's, not that they weren't there, I didn't know that they were there. So there is still a disconnect happening. And a lot of it is just because educators don't have the time. Right. They're not told all of the services that are available. We're not making sure that this is a priority, that the adults in the school know how to support the students. But, the other end of that is parents. Parents also don't know either, right? They can't get the information. They don't have access to it. Nobody's helping them coordinate these services until a student winds up down the line in the Juvenile Justice Center. So I'd like to hear from some of the panelists, what does the role of parents currently look like? How are parents included in any of the models we've discussed? And what exactly are family engagement plans and their roles? And Victoria, I'm going to start with you.
Well, keep in mind, I'm the school nurse, so we call parents a lot, and it's often very difficult because parents, again, I chose to work in economically depressed situations, and parents are working, sometimes working 2 jobs. They're tired. They don't want to hear it. Some of them don't even want to come pick up their children. Then there's the cultural difference, which is difficult. Then you have economics. Some parents will tell you, I don't have the money to take them to the dentist or to the doctor, and I can't do that. So it is a challenge. And then there are parents, because of the cultural and or religious preferences, their perspective of healthcare is different than what the school nurse may have. So it is a challenge, often a challenge.
Thank you. And Brian?
Thank you. So just touching upon one of those points, and something we've sort of broached a little bit, but haven't really touched, is we have to reduce stigma in all communities. Right now, stigma is another major barrier that we're facing, and it's certainly more prevalent in certain cultural groups and certain groups, but it's something that's universal as well, quite frankly, and it's something we need to be working very effectively to reduce and to really eliminate stigma. But as far as the question about parents, I think it's such an important, and I understand there's all these financial challenges for disadvantaged youth. I actually worked in a youth mental health clinic for disadvantaged parents for about 5-6 years, and even with that, it's so important to engage parents, and that's sometimes a challenge with parents that work a lot of hours. But you have to get them involved in their child's care. Parents are children's first teacher, and they're critical not just to kids who are distressed, but to all kids' development. They're such an integral role to academic success, to emotional maturity, to intellectual maturity, and to being healthy. So I think it's really important to engage parents and to find out how they can engage and understand that everyone does have different challenges, and that may sort of moderate how they engage, but it's important to keep that and not give up on that engagement. Certainly both of the models that we've discussed really hold parent engagement as integral parts of the model. The Clayton model views parents as a key participant in helping to reinforce the social emotional learning of the child, of the youth. Parents are engaged in both engagement and reinforcement of desirable social emotional learning behaviors. Parents are engaged in the behavior plans and helping make sure that behavior plans are not just followed at school, but followed at home too. They have to live with the child and be part of their life for them to be really effective. Parents are also involved in the positive reinforcement of desired behaviors as well as character development. Likewise, the healing-centered engagement model that we discussed, this also holds parents as a critical piece, and it really encourages parents to deal with their own trauma, because we know that trauma, unfortunately, is often multi-generational trauma. Those who have experienced trauma there may be a cycle of trauma, unfortunately, and we have to break those cycles. We talk about that quite a bit. And so the health-centered engagement model really focuses on making that healing for the whole family. And it really is an asset-based healing environment that empowers the parent to be an active participant as well.
Lisa, you wanted to add to that?
Yeah, I just wanted to add some. So within the juvenile justice system in the state of New Jersey, one of the strongest things that we've worked on within recent years is engaging our families, having them, like everyone has said, be a part of the process, because we find that, it works better if they're involved, and outcomes are also better if they're involved. In working with parents, and this is kind of a mind shift, and Victoria, this goes back to you say, the parents don't want to pick the kids up, you take my child, fix them. One of the biggest things we have to support our parents is the understanding that they shouldn't abdicate the role as a parent to a professional, because in the long run, it kind of undermines their ability to parent their child. And so that's just a side note. But in terms of engagement, we also now have in Atlantic County the Community Engagement Committee. And we do a lot of that on the ground, on boots on the ground work out in the communities. We have a resource booklet of our own that has a lot of the grassroots the services that are out there in addition to all the professional services. And so, we go to like community barbecues, and things like that to distribute those and, talk with families about, things like mental health, their child's involvement with the juvenile justice system, all the kind of scary things that go on there. So that family engagement is an important piece.
It's very important. And so it seems like we have people that want to help, we have students that need help, but we're still not quite meshing, and we're still not building the robust systems that we need because we have such a high incidence of depression and other issues within our youth. So to help build programs like we've been discussing today, New Jersey can leverage grant programs that facilitate these partnerships between community providers and schools, making this more of a wrap-around type service environment so that the families, just like we keep saying, the families and the students are supported. For example, in Kansas, approximately 2/3 of children improved their attendance, 60% improved academic performance, and 70% improved external behaviors. So I'd like to hear from Amy, what more can we do? What might these partnerships between school and community providers look like? How might New Jersey leverage community providers to build public and private payers?
Yep, and we're hearing a lot of really great examples. I just want to say, even in my own school district, just this week, the Education Association funded an evening where they had the parents come in and you could bring all of your kids for a fun night, but they had the parents go upstairs for a little bit, talk to them about some of the mental health suggestions and things signs, things they should be looking for while the kids engaged in these fun activities. And they provided food, so it was like a pizza night. Imagine how many more people would be in this auditorium right now if we had said that there were going to be hors d'oeuvres tonight too, right? So that's the kind of thing if you really want people to show up, you have to figure out, what can I take off their plate? And it might be childcare, or it might be a meal prep. And if I want them to participate, we have a teacher in our district who's also PTA president. She does the PTA meetings at Smile Factory so the kids can play downstairs and the meetings are upstairs. And it's just really creative. I'm in Brigantine, by the way. So, if you're wondering who's doing all this good work, the educators there are fantastic and trying to be creative. But it's all grants, right? So the grants, the Project Aware grants, the SAMHSA grants, the ESSER dollars, whatever it might be, we need sustainable funding, and we need to look to states that are already modeling this. So, for example, in Michigan, they've just started a project where they created a funding designation for a technology platform. We need that if we want to know what services are available. Because, to count on Lisa to get to every school and be able to do this, we need the technology platform funded for the whole state to know what services are available, so that when the child in Michigan, the way that they've set it up is it also does the screening. So then the screening creates this hub that you can then, schools, once someone screens for something, they'll know which services are needed. I've seen it done through the nurse's office as well, where the nurse's office can then be able to refer to services, but they need to know what's available in order to be able to do that. And so having that technical assistance from the state for the districts is going to be really important. In other districts and in other states, they're creating behavioral health learning collaboratives to compile all of those resources. So California is doing that. Washington State's thinking about how they can make all of the resources available, including training and credentialing that's going to be available. How can we bring people up to the top of their license and make sure they're working at the top of their license? So if you have a guidance counselor in your school, how are they spending their time? Is 85% of their day student engagement, or are they being asked to do some of the work for testing which was the case where when I taught in Northfield, a lot of the testing and state testing fell on our guidance counselor. So we want it to be front-facing, student-facing, working at the top of their license, and thinking about ways that we can leverage the funds needed from the federal government in New Jersey. And currently, we have students with IEPs can get mental health care covered. They might be using IDEA funds to do that. But we know there's a lot of kids who are having a hard time that don't have an IEP. This might be something that they just need some help right now. It might not be a diagnosis, but maybe from the pandemic, they've had some anxiety. We're going to see the U.S. Prevention Task Force is recommending that students ages 8 and up be screened for anxiety, students ages 12 and up be screened for depression, as Dr. Isaacson talked about. You know, those are things that we're seeing and need to be addressed, but then how are we covering those by getting Medicaid reimbursed? And that has been available since 2014. New Jersey hasn't done it yet. 17 other states have already done this. New Jersey also holds on to a majority of the Medicaid funds in administrative fees instead of transferring that and funneling it directly to the districts for them to use. And so that's really important in the way that we make changes so that the funds go to the districts that need them and they have the resources available.
Thank you. Before you go on, that Educator Night was funded by a grant that NJEA provides, which has been an amazing thing over the years. It really allows educators to provide food, provide resources for parents, have the entire family into schools, and we do it at the county level. This year at the county level, we partnered with Chef Andre Murphy, and he does a community feeding tour. So we actually went to the after-school programs that are through the 21st Century Grant Program out of New Jersey, and we fed them dinners because the grant doesn't provide them dinners, which is a whole nother discussion itself. But again, we keep mentioning grants, right? And grants are not going to be sustainable. And, you know, if another kind of hot button issue comes up, the money gets pulled in that direction and we lose those grants very, very easily. Brian, you wanted to add to this question as well.
Yes, thank you. So Amy already touched upon many of the points I was going to discuss and did a wonderful job answering. But there's one thing I'd like to add, and that is that so many states, not so many states, but some of the more advanced states where I think we want to be are having sustainable funding, not only for all the other services we've talked about, but for child psychiatrists to be embedded in schools. And that, to me, is such a boon when we talk about parents who struggle with working 2 jobs, parents who struggle with the time commitments and struggle with so much on their plate. Imagine where a child, and I worked in a system like this before I came back to New Jersey. I'm from New Jersey. Imagine where a child could be seen by a child psychiatrist at the school, only miss class for 30 minutes. The parent, now with our new technology, and we'll get to this question soon, could be telehealthed in, and then they only have to miss a few minutes of work rather than a couple hours going to the school, picking their kid up, driving them to their appointment. This is such, to me, a no-brainer, but it's still something that's eluded us for many of our school systems. And this could be a huge advancement in trying to address some of the challenges that we're talking about.
I just, to go back to that, you know, I think there's that notion, why are we taking time out of the school day to deal with health, to deal with that, you know, checkup from the neck up? But there is no learning unless we address this. Right. So that 10 minutes out of class, because we know that there's availability at that time, we know that the services are easier to access, means that maybe that student will then be able to be focused, be regulated for the rest of what happens throughout that day. So it's really crucial, and we would pull somebody out to deal with literacy, to deal if they needed any kind of extra support in math. This is another skill building. They're building life skills, they're building relationship skills, things that they're also going to need to thrive.
If I can add one
Sure.
other thing, I'm going to tell a very brief story that's one of my favorite. I'm a residency training director as well, and I always tell this story to prospective residents, but one of my favorite patients I ever worked with was in one of these school-based programs. And her mom was sort of like, why are you doing this at school? But to Amy's point, no learning was happening. This girl was referred to me because she was, quote, stupid. And it was such a heartbreaking thing to hear. And I did an evaluation on her back about 15 years ago, and she had ADHD that was untreated. I started her treatment at school, and I'm going to tell this much quicker than I tell it sometimes, and she became a thriving student. And now this is 15 years ago, so I'm dating myself a bit. She is now in her family medicine residency and has returned to her community, which was in New Orleans, and she's going to serve the people of that community, all because they took the time to address her mental health needs, and she never would have been successful without that intervention.
Thank you. I know there were a couple others that wanted to speak about telehealth as well. Lisa, when you and I were speaking about this panel, you mentioned that telehealth was really important during the pandemic. You want to share that story?
Sure. So, for any family that's been through the juvenile court system prior to COVID, you know, a youth and his family would be scheduled. You need to come in on whatever today's date is, 9 a.m. for your court hearing, whichever court hearing that is. And so once COVID hit and we had to go switch to remote, it was a relief for families because, you know, they were no longer spending an entire day missing school or parent missing work to participate in what might turn out to be, you know, a 10 or 15 minute meeting with their attorney prior to a 10 or 15 minute hearing in front of the judge. And so telehealth, I'm going to call it telehealth, you know, we're holding court virtually. And, you know, families, we're there for families if they don't have access to internet. We provided, you know, an avenue for that, but they've been very resourceful in being available. And so, you know, it has been to the family's benefit and the kids not to have to, you know, miss a day of work and miss a day of school. The other thing is there are some schools that we've actually worked with where the youth can stay in school, just as you're speaking, you know, to participate in their court hearing. And so what that's done is it's expedited, you know, hearings and things like that. So it's had its additional benefit, you know, and it's worked well. And, you know, it's something that we're looking at, you know, moving forward, continuing that sort of service.
And Dr. Martino.
Yeah, I was just going to add, I absolutely agree that telehealth can be a wonderful kind of connection. Pandemic or not, I think we've now started to see reimbursement for telehealth because of the pandemic, and it certainly has been an option, particularly for youth. Again, I specialize with youth who engage in very risk-taking behaviors, and there is less stigma, or they are more willing to engage when it comes to telehealth, and I am able to include their parents because I have to, just because of the nature of the issues that they have. But they can even allow their child to have some privacy, but have them close by, you know, or have them come in for a part of the session to talk about some of the things that are going on and assess the risk, but allow also some time to talk with just the therapist alone. So I've found that telehealth has, you know, been a wonderful change with the pandemic, and I feel like for many clients it will remain as their first option because it's just a bit easier to engage in therapy starting out as a telehealth client. The thing I wanted to mention, though, for both Medicare, Medicaid, and insurances is we have to really advocate to continue telehealth services because they are already trying to limit access in terms of reimbursement for telehealth services. And so I know we're talking about Medicaid possibly as an option, but we have to ensure that telehealth will be allowed and that we will continue to be reimbursed for telehealth services, because that has put, I know myself as a licensed clinician, in an interesting position, whether or not you can get reimbursed for services if they're telehealth instead of in person, even though we've demonstrated both access is important and that it has been as beneficial as in-person sessions. In some ways, allowed people to access therapy who would not have done so in person. So I feel like it's important to keep that in mind, and we need to advocate for telehealth to still be reimbursed.
Thank you. As the panelists were speaking about this issue of telehealth and how it's been beneficial, I was reminded of, I once met, it was the Educator of the Year, I think from Georgia, and the reason why they were the Educator of the Year, they had a problem with a need. Parents were not coming into the schools, they were not engaged with the schools, and sometimes the answers are right in front of our face, and the answer in this community was that they put washing machines and dryers in the schools, right? Because the parents, it was a lot of time to go to the laundromat. So if they made those services available at the schools, the parents came into the schools. So sometimes that answer is right in front of our face and it's obvious, and yet people just aren't realizing yet. So I'm going to give the panelists a couple moments to add any final thoughts that they'd like to. If you did write down a question that you would like asked of the panelists, just hold it up. Adam can come around and collect. If not, we may be ending a little bit early. But Victoria, I'm going to start with you. Any last thoughts?
Only again, thank you for doing this, Melissa. I think it was extremely important, and I hope everybody found it worthwhile. I think it's a good jumping off point. Let's do it again.
Let's do it again. Thank you. Lisa?
Same, I'd just like to thank you, and, from someone who has funding and, awards funding, that idea of the providing the washing machines and the dryers in the school, oh, God, that sounds crazy, but that's what it takes, in order to bring, families sometimes to the table. It's that thinking out of the box. One of the most impactful things that I participated in was a community healing dinner in Atlantic City. It was provided by the One Neighborhood Evolution program in Atlantic City. That's a violence intervention program offered by the city. And so it was announced as a community healing dinner. And so there had to have been more than 100 people from the community. It was held at the Old Soldiers Home near Stanley Homes. And it was very impactful because they invited 2 guest speakers to talk about trauma and ACEs, and before you know it, they had engaged the audience in kind of an informal session, on those topics. And so it was very powerful. And I agree with you, Melissa, and everybody else that, we have to look at all the opportunities, ideas, even the ones that sound kind of crazy. So, yep.
And James?
Again, thank you, as everyone has said. The only thing I would add is, we haven't even touched on all of the angles that can assist in providing emotionally and mentally healthy teens and young people. I think we need to talk to our local communities and the local rec departments and realize that in-town recreation is not what it was years ago. Kids are becoming more and more isolated in their homes, and technology started that and COVID continued it. But the idea that the more we can get groups together, whether it's at a school or it's at a town event, the more we get communities, neighborhoods back out, and the sooner we start doing that, I don't think we have fully accepted how much of that has disappeared from our lives for a variety of factors, and how big a role that plays in healthy young people, and how comfortable they are in their interactions with different people through those events. So I think if I was going to say there's somebody that's got to be added to this next time, it's another community, a local rec organization or a VFW or somebody like that can provide resources for the entire community.
Great point. Brian?
I also want to join everybody in thanking everyone for being here, and thank you for organizing this. I'd also like to sort of build upon Mr. Reyna's, a couple of points he made. One, it's really important to be proactive rather than reactive. That's one of the things he said that really stuck with me as I was resonating and thinking about it. We know that if we build healthy kids, if we address issues that are affecting that health, and that includes recreation, that includes all the different things that can help promote health, that's going to be much easier to deal with than the pandemic, a second pandemic or a different pandemic of broken adults if we just ignore this mental health crisis of children that we're facing. So it's really time to be proactive, build healthy communities, build healthy children, because that's what's going to help secure healthy adults in the future.
And Sarah?
I would also like to thank everyone for being here, and I would just add that we also need to build more partnerships between the university and different school districts, so a different angle on community. So that's the reason why I came today, to talk a little bit about the students that I'm working with and I'm training, who are very eager to do clinical work in the school setting, but we need to have those proper supports there for them to do it. So I would say that the future is bright, and that we have many who are applying for and going on for higher education to get licenses so that they can do this work. So I think we just need to do a better job of partnering up with different school districts, not just for professional development, but also to provide those services in the schools.
Amy?
I think that we've brought up a lot of points. Mr. Reyna brought up kind of that lack of connectedness, which we're hearing so much about, and loneliness, as really being the heart of what we're seeing and bringing people together. We know that training needs to happen across the board, and that educators and mental health professionals are having a hard time too. So, making sure that we're looking at ways that we can bring people together, that we're working to advocate in our communities. There's a lot you can do to push the state of New Jersey, to push for resources in your own district. We know that we could be helping to build this pipeline of workforce by whether it's student loan forgiveness for those that are going into these frontline fields, whether it's making sure that we do the state plan amendment for Medicaid reimbursements and address the administrative costs that keep it from going directly to the districts, or whether we're pushing for that training for school resource officers and educators that want to know mental health first aid and want to know how to deal with having those conversations, and things we could do to bring parents in. If you're wondering about what you could do, Mental Health America has great resources as well as screening tools on their website. They're screening 500,000 kids a month are going on themselves, seeking it out, searching online, and taking screenings for their mental health. JED Foundation provides suicide prevention. They'll help subsidize it in districts that can't afford that. So if you're in a district that needs some work, but you just don't have the funds, the JED Foundation has gotten a recent grant, Mackenzie Scott grant, and they're helping to subsidize that. The Healthy School Campaign could teach you more about this Medicaid state plan amendment that we're talking about, as well as other things for health. And then Kennedy Forum, if you've already tried to seek help and your insurance has denied that claim, we're really talking about that. It's against the law to deny access to care or coverage for that care, any different than they would cover something for your heart or diabetes or any other medical condition. So we're focused on it. We believe that we can make a difference, and it's going to come back to how we're connecting with our community. Thanks so much.
Thank you. So we have some questions here, and we've obviously just scratched the surface of this discussion, as you can tell. And sometimes when we have discussions like this, we don't exactly leave with set answers. We're all in different communities, and those community needs look different. But I'm going to go through some of these questions. So, Dr. Martina, I'm going to address the first one to you, because we were just talking about the pipeline to getting more clinicians and others into our school districts. So, as an educator for licensed clinicians who will be the workforce of the future, how can we retain talent locally, and what do they want in an employer?
I think the biggest thing right now post-pandemic is flexibility in terms of what they're looking for in an employer. And I think for a licensed clinician, there could be the opportunity either for telehealth and some in-person, or some movement, between different school settings, or possibly being community-based, but also having some in-school services that they're providing. And I know that that's one of the biggest things that's come out for mental health care workers since the pandemic, is just being able to have flexibility of schedule, because it's really tough to listen to all of the ACEs and other issues that clients bring to you in a 9-to-5 schedule, Monday through Friday. So whatever that might look like in terms of flexibility, I think that's going to be key in drawing clinicians into the school-based setting, to have that flexibility of working at different times or working across different settings, and being mindful of not having too many clients on a caseload. I think that's been a big issue as well.
Yeah. Amy, you had talked about states that had created like these technology platforms so all the resources were in one place. Can you talk a little bit more about that? How do we bring these resources together to provide the comprehensive community tie-in?
So the example that a couple examples. For example, Michigan is going to present at MHA's conference about the Behavioral Health Learning Collaborative that they're working to form, and that plugs in private partners, public partners, community partners, and would do those screenings. And then once someone screens for a diagnosis, it might be eating disorders. The resources are not in the school building for that. So how do we find somebody for that young person that's going to meet what they've screened for? And so this technology platform connects to those services. And that's something that the state has done legislatively to set up funding specifically for that, separate from all of the mental health services that they're providing. But we're seeing even in, I mentioned Washington, where they're just creating a library of evidence-based curriculums and evidence-based practices. And, people want to do the right thing, but there's a lot, this is new territory for a lot of districts and a lot of schools, and we're flooded with materials and vendors and people that are getting into this space. How do we know, going back to that outcomes, how do we know which ones will work so that we're not throwing money down the tube? Because we know that unless we can prove outcomes, the funding won't be there. We have to show it's making a difference in order to get people to continue to buy in and say, yes, this is worth supporting. So that's a little bit of what we're seeing. And, in some states like California, they're also able to tie in the billing as part of that network, that technology platform as well for Medi-Cal. And, one area where this is going to very soon be urgent is when we open up 988. So for those of you that don't know, in July, the new 3-digit number 988 gets turned on, and that is to coexist with 911, but for behavioral health. So if you have an emergency, you're no longer just calling the police line and saying, come, which we all can agree, that sounds really promising because we want the right type of response for the situation. But unless we can connect the individuals that call to some services that are coordinated, which we haven't really mapped out in a substantive way, we're going to have a lot of calls and not a lot of answers. And how will that be connected to a school if it's a young person, so that the school knows what to prepare for when the student returns? If there's an incident and 988's called on a Saturday night or a Thursday night even, and the student comes back to school on Friday, what was the follow-up? How do they know? And how have they been included in this plan? And that's where some of the technical assistance will be important, and why we need the resources to build that out.
Thank you. Another system that I was learning about recently was Utah has a text service for a student who is being bullied, which I thought was also a great statewide effort to make sure we're supporting the students. And we haven't talked about victims too much here because we know that the other side of this coin is that people who are experiencing depression or mental health issues or self-esteem issues tend to lash out at other students to make themselves feel better. recent case in point with the potential of what happened in Texas. So we need to look at these statewide supports for the students, for the victims, and for the educators. Washington, you mentioned, Amy, they've done a great job recently in creating and collating a bunch of resources for educators who are experiencing workplace bullying, harassment, and intimidation, and are offering different trainings to the educators in that to make sure that they know their rights and they're standing up for their rights. And again, that was done through legislation, and that was done through money that the state put forward for those efforts. And speaking about the past week and the level of stress and fears of the school shootings, maybe, James, you might be the one to answer this, if you don't mind sharing what's been done and what is being done to help students handle the fear that they're experiencing right now.
That's a question that I don't know anybody can provide a succinct answer to. Every school, I think, has responded slightly differently based on the culture of the building or the relationships or the history within the building. I'll answer from a 9 through 12 perspective. We operate 3 high schools. A K to 8, I think, would have a very different answer in how they would respond. Say a Brigantine, for example, might be different than larger high schools with 1,000 to 1,200 kids in each building. We usually look to try to make sure that students understand from the beginning that there are a dozen resources throughout the day. Every single one of your teachers is a resource if you are feeling nervous. Every single one of your teachers is a resource if you have concerns. In addition to that, there's the guidance counselor, there's the child study team. We are partnered with AtlantiCare for a multi-tiered system of support within our buildings. We have Tier 1, Tier 2, and Tier 3 specialists within all of our buildings. So they actually deal with some students. We try to catalog over the years students that we know have been involved in trauma. So for instance, our guidance departments have a list of students who may have been involved in gun violence or somebody in their family was involved in gun violence. And that's continually updated by our relationships with law enforcement, our relationships with the family. So the next morning we're knowing the students that we might have to keep an extra eye on, or we might go seek out, or if they're not in the building, again, you be proactive and you reach out to the family. Hey, we're sure this has to be a difficult morning for John. Please let us know when he's going to return. How do you want us to help? Do you want somebody to come out? So again, I think there are a number of approaches you can take, but I feel like all too often over the last number of years, we are, and I shudder to say this, but students are becoming used to it. In the sense of they read it on their phone. It allows for a conversation to happen in class, but it's frightening to think that I think many students, especially at the high school level, they have a remembrance of Parkland. They have a remembrance of other events. So I don't know that there's one clear answer. But it's the idea, again, like we said from the beginning, I believe, of being proactive and having your students know where the resources are before they need them.
Thank you. There was a couple other parts to this question. Does the state have any programs in place? I don't know specifically of a state program besides a reactive one, right? We practice the active shooter drills. The principal handles that in our building. Superintendent works with the police to lay out the plan.
We do. I will also give the Department of Ed, we all have those standardized drills. The Department of Ed has also over the last few years taken a very strong approach on requiring additional training, school safety specialists in each building who's not law enforcement. So there is one person who can kind of become the facilitator of all these trainings and all these responses. But the very fact that we're sitting here, again, I think you have to realize that it's a mental health approach as much as it's a PD approach, as much as it is also a school security approach. The Department of Ed will offer the opportunities for schools to sign up, and they will come out not to play gotcha, but they will actually bring out representatives from the Department of Ed. and some law enforcement, and they will critique your response. They'll say, okay, we're going to run a drill today. And nobody in the building knows that this was going to kind of be observed by them. And it's a great resource for them to give you immediate response. This is what you did well. This is what you need to work on. So if you're willing to partner with the Department of Ed, programs like that are available.
Okay, thank you. I'm going to actually take this next question. How can the NEA work to get more funding to the mental health programs, right? So the NEA has a lot of initiatives going on right now. Community schools that include wraparound services models. We have the healthy, safe, just, equitable schools discussion coming up this year at the convention. These are all important discussions. And if you want to get involved in any of these lobbying or this advocating for these programs, I urge you to seek out to your local president, the county. We can help you at the county level and how you can become involved in making sure that NEA continues to push for these resources that we need in our schools. And part of also the conversation that NEA has, and this was mentioned in the next question, is around restorative justice. And there is a pilot program in the state. And so how do we feel this is a tool? Is it a tool? How do we feel about it as a tool to support mental health wellness in our schools? And I don't know. I know, Lisa, we had conversations about restorative justice for a number of years.
Are you speaking about the pilot program going on in the 4 counties?
Yeah.
Yeah, for the restorative justice hubs.
Mm-hmm.
So I believe they do present, and that's the idea. They do present an opportunity to address mental health in addition to, all those other risk factors that bring youth or make them at risk to enter the juvenile justice system. So ACEs, of course, does, it makes that more likely. And so I do believe, though, that those hubs, and the idea is that they be located in the community where any youth, family experiencing at risk, having an issue, could go into one of those hubs. And that present in that hub would be the variety of services like Amy talked about, kind of that wheel. And, if it's this issue, we can deal with it over here, or we have this entity. So I believe that's the idea. And I'm hoping Atlantic County will be in the next round.
I hope so.
Me too. But yeah, and the restorative justice, it has also an opportunity. You're talking about SROs in school, and what they look like, to kids and families. Police officers have, that kind of stigma. But the piece of restorative justice is to bring the individuals that are involved in, let's say, an incident where a youth might be charged with that incident. Let's say that youth has a mental health issue, or there are ACEs within that family or other factors. That restorative justice hub would enable that kind of conversation between victims and alleged offenders, to reconcile and figure out, what can we do so that this youth does not enter the juvenile justice system? What other opportunities do we have to, address what's been done, allegedly been done, and hopefully provide an opportunity for the youth and family to, maybe go in a better direction, a different direction. So, yeah, and I'm hopeful we're going to get it next.
Does anybody else have anything they want to add about restorative justice? No? Okay. So I'm going to end with 2 final questions, one kind of negative and then one kind of hopefully positive. So what are the potential future impacts if these issues are not addressed today? Does anybody have any words to express with that thought?
So I touched upon it earlier, but I think that if we don't address the youth mental health challenges that we're facing now, we're going to have an almost insurmountable, or at least a very challenging wave of adult psychiatric needs in the future if we're not building proactively programs that help encourage true health in our individuals. And one of the things I want to touch upon, mental health is health. So it's not just mental health, it's all health. We need to be proactively focused on the health of our youth, addressing any of their needs in a way that's meaningful and will allow them to thrive so that we're going to have a healthier society in the future.
Yeah, also, as we think about lifespan, this is the first time we're seeing a decline in lifespan because of these deaths of despair. So we know all of those things that are ACEs that we talked about, whether it's substance use disorder, alcoholism, what it might lead to, incarceration, and then the deaths of despair. So looking at how our overall health as a nation is being impacted, how our workforce, our potential workforce is being impacted. I think CEOs are really thinking about this already and considering workplace mental health and how they can make adjustments now because of burnout, because we've seen the Great Resignation. A lot of employers who want the best, they want the brightest, they want the most, just like in school, on-task behavior, right? And that means that you can't have intrusive thoughts while you're at work. You can't be fixated on all of these other issues that you're facing in life. And so we have one of the greatest losses in productivity is because of mental health. When they look at the dailies, they say the lost productivity, that mental health conditions, so that when you're at work, you're calling out either because you need that mental health day or because you have a loved one who's struggling. Because we know, as Victoria mentioned, and Lisa talked about parents coming to pick their kids up or, having to miss work for all those appointments. This is a big deal, not only for just because it's the right thing to do and we want people to thrive, but also because it will impact our economy in the long run.
Yeah, just building upon that, right now, disability-adjusted life years, depression is the second leading cause, and there's projections that by 2025, it'll be the first leading cause if we don't bend that curve and really intervene now.
That's kind of a scary thought. That's only a couple years away. We need to act now. Okay, so I'm going to bet that this last one is from an educator because this is the perfect way to wrap up this panel. And I'm going to call on everybody, and I'm going to start with you, Amy. What one word would you state to rally community members' support around the topics discussed to bring about solutions to the many areas discussed? One word.
Sheesh. No pressure. No pressure.
Urgent. It's urgent. It feels like this has to have already been in place. We need to be moving on it. We cannot wait until next September to put these things in place. We can't wait till the next administration. We can't wait. This has to happen right now.
Dr. Martino?
Collaboration.
Great. Dr. Ozaikson?
I liked urgent, but I'll also say resiliency. And I'm going to say why. Because kids are incredibly resilient. If we make changes, they're going to thrive. This is something that we can do something about now. So I know that wasn't one word, but resiliency I'll go with. Sorry.
You looked poised, ready to answer. Go ahead, Mr. Reyna.
I'm going to say community-wide, because whether you're talking about how we got here or how we're going to get out of this, it is a community-wide conversation.
Great. Lisa?
Can't say more than one word. I would have to say partnership.
Victoria?
One word is tough.
One word is tough.
Humanity.
I like that word.
Good one.
It's similar to my word. My word today is hope, right? Because if we don't have hope, we're not going to go through the steps to find the solutions we need. So with that, I'm going to thank first the panelists. Everybody give them a round, please. And I want to thank everybody for attending and listening to us. Hopefully this will spark some conversations in your own communities and in your own districts. And maybe we'll all take a couple minutes to pay a little bit closer attention to what's happening around the state. Thank you.